So today we are going to be administering medication using the piggyback method. I will scan my area, and then I will gather my supplies. And for my supplies, I have my primary bag, my medication, my primary tubing, my secondary tubing, my alcohol wipes, and my gloves. So I will do my first check at this moment. My first check is checking the medication, that I have the right patient, right time, right medication, right dose, and right route. And I'm gonna do this by comparing the medication against my computer. If I have a computer, I'm gonna compare it to the name and just make sure that I have everything correctly. So after I gather all my supplies, I'm gonna go into the room, and before I go into my room, I will be doing my second check because I don't want to be walking out of the room and walking back in. I'm gonna just check that again I have my right patient, right medication, right dose, right route, and right time. Okay, so I will then go into my room, knock on the door, and I will perform hand hygiene and perform aided. Hello, Mr. Ivy. My name is Hefzi. I'll be your student nurse today. We are going to be administering your antibiotic through your IV, and this will take 10 to 15 minutes. So the medication that I will be administering is for your pneumonia. The name of it is piperacillin, and it's going to be 4.5 grams Q6 hours. And so for this medication, my assessments are going to be to listen to his lungs, his heart, and bowel sounds. And so after I do that, I will, and actually before I do that, I will check my patient's wristband and confirm his identity using two identifiers. So can you please tell me your name and date of birth? Okay. Also, while I'm doing this, I'm going to be assessing his IV. I'm going to be looking for redness, infiltration. I'm going to check if it's swollen or if it feels warm or cool. Okay, so it looks fine to me. Before I put my medication in, I'm going to be looking at my patient's MAR and looking at his allergies. This medication is contraindicated for people who are allergic to penicillins, cephalosporins, beta-lactams, and tazolactams. And so if he's allergic to any of those, if he has had any reactions in the past, then I will not give the medication. Also at the bedside, I will ask my patient for any allergies. Do you have any allergies, Mr. Ivy? Okay. Have you had any allergic reactions to any other medications, or do you have any sensitivities? No? Okay. All right, then I'm good on that area. So I'm going to prepare myself to hang the medication, and while I'm doing this, I'm going to talk a little bit about my medication. It's an antibiotic, and it's part of the penicillin, so always know that this can cause rashes, it can cause anaphylaxis and GI dysfunctions. So I will have my emergency equipment at the bedside in case my patient reacts to the medication. I will also use cautiously on people who have any renal impairment, people who are in sodium restrictions, and if they are pregnant or breastfeeding. Also, if they are critically ill. Okay, so I'm at the bedside and I will perform my third check. So I am gonna grab my medication. I have the right patient. I already confirmed his name and date of birth. I'm going to grab my bag of saline and make sure that I have the correct one that the doctor ordered. and I will scan my patient's wristband. Beep. And I'm going to scan the bag as well. Beep. Okay, I'm going to perform hand hygiene, and I'm going to grab my gloves. And I'm going to grab my primary tubing, making sure that it is unclamped. And I'm going to clamp it. Okay, and now, not contaminating either end, I'm going to take off the lids, not touching or contaminating the spike. And with one firm push and twisting motion, I'm going to spike my bag. Okay, so it's spiked. And then I will hang this up here. This hanger came in my secondary tubing bag, so I'm just gonna hang it in the hanger. And we're gonna open the tube, unclamp it, because we want to make sure that it's flowing. So we're gonna fill this chamber. And we're gonna open it and let all the bubbles out. Alright, great. So it's flowing, the bubbles are out, and now we're gonna clamp it again and hang it out of the way. And now we're gonna get our secondary bag. And again, we're gonna do our check against the MAR. We have the right medication, right dose, we have the right patient, it's the right time, and we're gonna do the right route. So I'm going to grab my secondary tubing, and again, it's unclamped, so I'm going to clamp it. I will remove the caps, making sure not to contaminate either end, and with one firm push and twisting motion, I will connect my secondary bag, my antibiotic, to the secondary tubing. Now this time I am not going to fill the chamber, but I'm going to use what they call the backflow. So I'm going to fill my chamber with the saline. I'm going to need my alcohol wipe. I'm going to wipe both ports and connect them. Okay, and then I'm going to lower this to fill the chamber just part way. This needs to be open. Okay, so it's not all the way I can still see the dripping from the antibiotic. And we can open this back up. Okay, so that is set up. And now we're going to look at our patient's IV site one more time. And we're going to make sure that it's patent. So we're going to grab our saline syringe and we're going to do the flush. And it's working just fine. Now I'm going to clean this port, and I'm going to clean my patient's port with a different alcohol wipe. I will connect it. And I will set my infusion rate and make sure that it is flowing. And then I will stay with my patients a few more minutes, and I will teach him about any side effects. If he has any, if he feels like his throat is closing, or if he has any redness at the IV site, then I'm gonna have him use the call light as soon as possible and let me know what his reactions are. I'm gonna tell him that I'll be back in 30 minutes to check on him, and I will make sure that all his possessions are close to him, that the bed is on the lowest position, and that the side rails are up. And then I will remove my gloves, perform hand hygiene, grab all my equipment, leave the room, thank my patient for letting me take care of him, and then do my documentation.